Hey, Annalissa. All
Hello.
right. How are you?
Good, how are you?
I'm good. All right. So I know we're getting together to hear a little bit more about your story, learn about Annalisa, learn about your journey. So I think maybe a good place is, take us back to before you came into the FQHC world. What were you doing before you joined your first FQHC? What did that look like?
Yeah, so my journey is a little bit funky. When I was 16, I started working at this place called the Children's Cabinet. That was like one of my first jobs. And I actually was planning to be a social worker. And so I was working with CPS cases and just shadowing social workers. And I like really developed kind of an interest in the substance abuse disorder world. A lot of the parents that I would work with were oftentimes struggling with substance use disorder. And so that kind of sparked my interest. And so I went to school for my undergrad in public health. And then I also majored
Mm,
in addiction medicine. And so from there, I started working in addiction medicine. I worked at a rehab and I got accepted into my master's program. And so I moved to Portland, Oregon to complete my master's. And then that's how I got started at my first FQHC
So you moved to Portland from where? Where were you before that?
from Reno, Nevada.
So you went from Reno to Portland, and then back from Portland to Reno, and that's when you
Yes,
started working at an FQ.
in Portland, Oregon. Yeah.
Got it.
While I
Okay.
was getting my master's, because I was wild. I was getting my master's, working full time as a substance abuse counselor, and also had two internships. But before that, I had already started working at a rehab in Reno. So that was like kind of my introduction to like the social services nonprofit space.
Got it. In your substance abuse work, right? Because I've never been in that space. I can only imagine what it's like. What was the most impactful thing you experienced either through just in your entire process of doing that work? What would you say was the most impactful that you probably didn't expect to experience?
Yeah, I think I was just like so naive to like understanding substance use disorders. And I felt like I had
Mm,
like internal bias towards people that had drug addictions. And so that kind of like opened my eyes to one, like a different form of empathy and like connection, regardless if someone has a substance use disorder or not. They are the exact same as us. They have the exact same needs that we do. They all want love and connection. And so that's really what drove my work. And something I would always remember is that although the person that I was like counseling might have a drug addiction, they really behaved the exact same way that like the rest of us do. They just have a different needs and they just have a
mhm.
different need in terms of a substance use disorder. So that was, like, really eye-opening. I also was so young. I was so young dealing with people, like, fresh out of prison. I would connect with their parole officers, and then they would establish with me, like, the day after they were released from
Oh,
prison.
wow.
I would assist them with getting started on medication-assisted treatment and was their therapist. So, it was a wild thing. I also worked at the syringe exchange, and so I would twice a week go the FQHC I worked at in Portland, Oregon, we had a connected syringe exchange, so I would go there 2 times a week, hand out fresh syringes, and then I created, like, a clean referral process from the
Mm,
syringe exchange into the medication-assisted treatment program.
wow. That's not easy work. That's not easy.
Work, no.
So once you were in the FQHC, did you know what an FQHC was before you started working there? What was that process like?
No, I had no idea. So I actually, when I moved to Portland and started my master's program, I was working at a grocery store. I worked in like the cheese department at a grocery store. And I one day after class was talking to my professor and I was like, I'm really interested in working in substance use disorder. Do you have any recommendations for me? Um, Before I moved to Oregon and I was living in Reno during undergrad, I had like helped volunteer at the syringe exchange in Reno. And so I was explaining this to my teacher, and she recommended the organization that I started working at, which was called Outside In. And they happened to have
Hmm.
a job opening for a medication assisted treatment counselor. And so I jumped at the opportunity. I was so excited because that's like all that I wanted to work in. I remember I was so excited. I called my mom when I got the job and I was like, Mom, I'm making $16 an hour. I'm so excited. But I
Ha-
had no idea what an FQHC was, and really had no exposure to it before that.
So once you got in, you get in, you start working, you're excited.
Mhm.
At what point did you start to realize how much work is involved in working at an FQHC? And let me ask, what was your title when you first what was your first title at your first FQHC?
Medication assisted treatment counselor was my first title. How much work it was, I realized how challenging it was with one, trying to get like patients into treatment. Inpatient
Mm,
options for patients are like so difficult and challenging to get into. And then I also realized how challenging it was for our patients without insurance or our patients who were non English speaking. I started to learn this as I would develop my caseload. And then in addition to that, it's even more challenging when you have like a felony record to be able to access some services, in addition to also having Medicaid, being non English speaking. It was very challenging to find options for a lot of my patients.
so when you say the challenge, so you're going through a process, you're building your caseload. Will you say the challenges were emotional, operational, both? And then how were you able to address those challenges? Like, did the FQHC give you resources? Did that come about?
Yeah, so I was very fortunate in that the supervisor that I had at my FQHC was like very receptive and fought for our team. So for instance, like I made it a point that I wanted all of my patients to feel the exact same way that all of the other patients felt regardless if they had a substance use disorder or
Mm.
not. So we like made the therapy offices very welcoming and calming, and
Hmm.
like I would consistently have conversations with my coworkers about like how to speak about substance use disorders, and really just trying to create like the easiest process for my patients specifically. And so my supervisor was very on board with that. I would
Mm.
say on the operational side, it was very challenging to get reimbursed. Obviously, we had to always defer to the state Medicaid policy and the reimbursement around medication assisted treatment. And so at first, we were just not billing at all. It was just like a non billable
Oh,
service,
wow.
which was very challenging. And then we unionized, and then because we unionized, they started looking at policy and trying to determine how we can generate additional revenue. And so then that's how we started billing, and then I had to adhere to Medicaid guidelines. So it was definitely challenging because at first, like, I think the mindset of FQs is often like, well, let's just start a service, it'll help our patients. But how do you
Right.
keep that program running so that it's not only servicing your patients, but also not like drowning an FQHC who's already so limited on their resources?
All right. So you're doing this work, you're still in Oregon, then you come back to Reno, right?
Mhm.
And that was another FQ.
Yeah. So
What was that like?
when I moved back to Reno, I had completed my master's program, and then I started working at another FQHC in Reno. And I just wanted to get my foot in the door. I was like, I want to work in healthcare. I want to work in a nonprofit healthcare. I was like, whatever job opening they have that I can do, I'll do. So I once again took a job that I was my title was Healthy Living Program Coordinator. So worked
Mm.
with a pediatrician, and we essentially assisted families with like healthier options. So I would teach weekly, or I might have been bi-weekly, like nutrition classes and healthy option classes to families. specifically with children who like had elevated triglycerides, who were
Mm,
pre-diabetic or diabetic. So really trying to create healthiness amongst the children and the parents. And so it was like a 7-week course. And once the kids completed the course, they would get a free bike, which was really cool.
that's
Um,
cool.
yeah, it was a cool program. So that's I took that job once again. Like I think it was like non-masters, but I was like, I want to get my foot in the door. And then I was lucky enough that my supervisor had gotten switched at the FQHC, and I was directly reporting to our chief clinical officer, which like in the org chart that doesn't make sense at all. But she was like, why are you doing this job? Like you could be doing so much more.
Hmm.
And I was like, well, I just wanted to get into this organization. And so she was like, I think you should be our project manager. And I was like, "Sure," like, and so they just, like, moved me after 9 months into the project manager position, and I reported directly to the executive team, and I basically just did any project that they thought of. So, one thing they were like, "Okay, we wanna, like, update our registration packet, so
Mm.
look at that and make it easier for patients when they're coming in, make that process a little smoother." I like assisted with our nutrition program because for whatever reason, the way the Medicaid policy was set up was not allowing our dietitian to bill for her services. And so I had to like uplift that. And actually I had to like fight with Medicaid about changing their policy, which they did so that we were able to bill for our dietitian. Looked at behavioral health billing because our behavioral health program was like non-revenue generating. I was looking at productivity and determining the codes that they were utilizing and trying to get them to see more patients. So we actually switched our whole entire behavioral health model from like a warm
Mm.
handoff model to consistent like scheduled appointments because I think our average before was like less than 2 patients a day.
Oh,
It was
wow.
like the providers weren't utilizing the warm handoff model. So we completely changed our behavioral health model. And so I did that for a little bit and then I moved into population health. Once again, our chief clinical officer was like, I would love for you to do this and you could develop more programs and help us on the value based side and help us grow our incentives. And I was like, okay, sure.
You said something that caught my attention. So when you went into this organization, you just wanted to get in, you wanted it to be healthcare, you wanted it to be nonprofit. You found this organization, you went in there, knowing that it was probably not the position that you could have gotten had you looked for a different position. Why do that? Why after all the work you put in, after getting your master's, after all that, why go through that process and land at a well, some people consider like a lower position than you deserve? Why?
It was just really important for me to work in the nonprofit sector. I could have continued like I was doing catering on the side and working at like the same job I had in college and I felt
Mm,
like it was like a step backwards. I really am passionate about working in nonprofits. I'm really passionate about the patients that utilize FQHCs. I'm really passionate about the mission of FQHCs. So I was like, you know what? I understand like my capabilities. And so I know if I get my foot in the door, I can grow within the company. So, I mean, I also like, yes, I was like kind of taking a step backwards in terms of my like career, but I also was new to the FQHC space in Nevada, which is very different than the FQHC space in Portland. And so, and I also wasn't licensed in Nevada. I was only
mm.
licensed in Oregon. So that was also a barrier. And so I just I was ready to get back in healthcare, regardless if it was like, maybe not a, a lateral step.
Okay. So how long were you at this last FQ?
For a little over 4 years.
And then what happened? What made you say, "Hey, I'm gonna turn my life around and I'm leaving to the other side of the country," and what happened there? Like, what made that switch, right? Because I'm seeing kind of a pattern where you weren't afraid to almost restart when you moved back to Reno, right? You started at the
Mhm,
bottom, I would say, where
mhm.
you could have pushed somewhere else. and then you took a turn.
Yeah, it was definitely a very challenging position to, like, just pick up and leave. I think about
Mhm,
for reading Who Moved My Cheese?
mhm, mhm.
Um, and I remember, like, being so afraid. Like, I remember falling asleep in Reno and being like, "You can't move to New York, like, what are you doing? You're crazy. You don't know anyone in New York. You don't have a job." Like, um, I very much so was of the mindset that everything would work out. And I felt that I had just really outgrown what I was capable of doing. And Nevada is a very, very small state in terms of FQHCs. Um, I I just really wanted to be my own boss. One, I thought that that was really important. I also wanted to really be able to do what I was doing in Nevada, but at a larger scale. Because I really, really enjoy that, like, program development and program implementation. And I was thinking that I could do that in New York or Colorado or California, whatever that looked like. So that really sparked my interest of, like, oh, I could work on the consulting side of things rather than just sticking with like one organization.
So here's a question. How much research did you do on consulting before you decided you were going to do consulting?
I did no research. I actually got recommended to consulting by someone. They were like, "Would you be interested in consulting?" And I was like, "Yes, like I would be interested in that." And it was always something that I had in the back of my mind, but I did no research. I had no idea. I truly had no idea. I didn't know what it meant. Like, I didn't even really know that I would be my own boss or that, like, I would have my own business. Like, I didn't know any of that.
So let's talk about that for a minute, right? Because a lot of people think, I think people think consulting in different ways, right? Some people think, oh, I'm going to go work for a consulting firm, right? One of the big fours, or maybe a boutique consulting firm, or whatever it may be. And you could totally be an employed consultant, right?
Mhm,
You could go get a job and be an employee that does consulting work for a consulting firm. That's probably the most standard way to do it, right? Obviously, we were fortunate enough to have you join Alcar Health. We're not, I tell people all the time, we're not your typical consulting firm. We don't, that's not our model, right? So you come in, you don't really do any research. You don't realize that we don't hire employees really. I mean, we have some employees, right? But
mhm,
what was that process like for you, right? I don't think I ever asked you that. What was it like when you figured out, like, hey, I'm independent. I don't have to, but I should start my own LLC. And then what was that process like for you once you realized? And I think I said this on one of our calls. I said, listen, you get to build your own business within Alcar. And if you ever decide to branch off, you branch off, right? So
mhm.
what was that process like for you?
I think that it was a little bit easier of a transition because my previous FQHC reached out and they were like, "Can you do some consulting for us? You know, we're having a really hard time finding someone to take your position. We'll have you consult for us for 3 months and you can train them on your position." And so then that kind of started to, like, raise some, like, what's the word? Some light bulbs started to go off. And I was like, "Oh, okay, like, I could do more consulting." The transition, I would say, and I know we, like, always had these conversations in the beginning, but you would ask me, like, "Okay, like, how are you with, like, basically creating your own schedule and, like, staying on task?" And because at the end of the day, like, if I'm a consultant and I get hired on by, X, Y, and Z, if I'm being lazy or not doing the work, one, that looks bad on me and my business, but two, I'm then, like, not delivering on things that I promised I would deliver on, which then creates, like, a bad reputation of me. So I think that that's a different mindset is, like, when you're employed, if you do a bad job, like, you can't just lose your job for the most part. Like, there's,
Mhm.
like, so many rules to that. And there's also, like, me doing a bad job when I'm employed, like, it falls to a group of people. But now as a consultant, if I do a bad job, that looks bad on me and my business. So I think that that's kind of the mindset is I'm always thinking like I am putting in all of the work because I'm new to this and I want to have a good reputation and I want to, like, prove to not only myself but also to my clients that I'm, like, capable of doing and assisting them. I also think like being that subject matter expert has like really like it's made me invest more, I think, into myself too.
Mm.
Knowing like, okay, I have this, like I've done this before, I'm capable of doing it. That's like a good reminder. And I always have that in the back of my head of like, okay, you made the right decision. Like it was a good thing that you like changed your whole entire life, moved across the country and entered a new field.
So you've been doing this for how long now? How many months?
I think 9 months, 9 or 10 months.
Aside from moving and obviously things being new and changing scope and changing where you live, now that you're working outside of the FQHC space, right? Meaning you're not working inside as an employee. What are some of the things that you're starting to notice from an outsider's point of view that you probably didn't notice when you were inside?
I think things I've realized is that FQHCs are different no matter where they are in the country. They are different. Like the state policy is different. They're all very unique. Um, I also have realized too that some like organizations are like very much so for their patients and the policies that they create, like everything is for the mission, which is how it should be for an FQHC. And then I think I've realized too that sometimes that's not how it works, and that is unfortunate. But I also understand that an FQHC is still a business at the end of the day. Like they're like, well, we can't service any
Yeah.
people if we close all of our doors.
Right.
So that's been interesting to like learn the ecosystem of all the different FQHCs. I also have really like a lot of people don't know what an FQHC is. They have no
Hmm.
idea. They don't know that acronym. They don't know like their options, especially like patients without insurance. They don't know like how to redetermine for Medicaid. In New York, if I go to a clinic, they have a financial counselor right then and there, they enroll me into Medicaid. And that's not how each state works. But like New York is so pro Medicaid that
Mm-hmm.
essentially like everyone gets on Medicaid here if you don't have insurance. And so that also varies state by state as well. So that's also
Yep.
been an interesting concept to learn.
Is the old saying, right? You walked into one FQ, you know one FQ. And sometimes
Mhm.
even by sight, things are different.
Absolutely.
I remember in the beginning, this was early on when you joined the team,
Mhm.
and you told someone that you had joined the team. Is a friend of ours. This person's an executive CEO at an FQ.
Mhm.
And that person made a comment about your age, right? And I believe their comment, and I don't think they meant it bad in any way, but their comment was, "Well, you're so young."
Mhm. You're so young.
And
Yeah.
what was your response to that? Do you remember?
I get that all the time. Truly, I get that all the time. I think I also, like, I also I think younger than what people think my age is. I am still young, but I think people think I'm even younger than I actually am. But I think I remember saying, like, "It has nothing to do with age, it's deliverables," and I have those deliverables.
Mhm.
Joe always Joe makes fun of me. I said, "I have amazing deliverables in our
That's
video."
exactly what you said. You said, "I have amazing deliverables."
I have amazing deliverables. And I have a lot of other executives that would back me up on that and be like, yeah, she like I said, I was 21 handling people fresh out of prison. Um and like helping them, and I had a really good success with my patients like getting on medication assisted treatment and
Mhm.
staying on medication assisted treatment and like developing really good relationships with their parole officers and like keeping them sober and out of prison. And I also was so young, and so I think that I don't like that. Like, I think that people are capable of doing anything at any age. Like, we have people who have done more than both of us combined, probably at like such
Sure.
young ages. So, I don't like the perception of like, oh, I have to be a certain age to be a consultant, because I don't think that that's true at all.
So, knowing that, right? Knowing that that's a challenge, or maybe not a challenge, but it's a view that certain people have, right? Like they expect a consultant to look and be a certain type of profile, age, whatever it may be, even initials, after their name.
Mhm.
What happens when you're talking to someone from an FQHC, and and maybe you haven't, right? But I'm just asking, have you noticed a difference in your conversations with people you just met? And once they realize that you've actually spent time inside an FQHC and worked in an FQHC, do you see a change in that, in their response?
Absolutely. I think one, like, just being a female in any
Mm.
space, automatically, like, I have to prove myself more being a female, being Latina. Like, I already
Ah.
have people that have like a perception about me and what I'm capable of before I ever speak or before they ever see me, like before they know, like, oh, she looks young. So, absolutely, I feel like when I have these conversations with people, I always have to sell the work that I've already done. Like, I have to sell myself, I think, harder than some people might have to.
What about once they know that you worked at an FQHC? Do you think that changes things for them?
Yeah. I think that changes a lot of things because they're like, "Oh, she gets it." Like, she understands our challenges. Especially, I mean, I understand them, one, because I worked in FQ, but I also managed so many teams in an FQHC that I understand it from a lot of different lenses because started, like, boots on the ground, an entry-level position, and then worked my way up, so I understand the different challenges that each of the seats feel and face.
Knowing those challenges and understanding those challenges from working in an FQ, what would you say are some of the biggest challenges that maybe some of the executives from director, VPs, C-level executives have from the frontline being front office, MAs, call center, people that are engaging on a day-to-day basis with multiple patients?
Mhm.
Is there a disconnect? And if so, what is that disconnect?
There is absolutely a disconnect. Being patient facing is obviously creates so many challenges, and then having to then create policies and procedures that impact not only the patients but also your employees and your staff. That's a really hard burden to carry. So they're both challenging in two very different ways. I do feel like there is oftentimes a disconnect. I always think of like if I were, a CEO of an FQHC, like I would make it a point to create committees that had everyone in them
Hmm.
because I think that some executives have never worked like an entry level position at an FQHC. So they don't understand that. They also are disconnected from like handling, like dealing with a patient who's like shows up crying or like lost their Medicaid and doesn't know what to do or can't pay their bill. Like, and so an executive's always thinking business. Like, I need to keep the doors open and I need to make sure that like things are running smoothly. Whereas front office is like, I need to find a option for this patient who's like crying or screaming at me or whatever that looks like. So it's just two different mindsets. Can they work together? Absolutely. But I do feel like that just naturally creates a disconnect between the two like positions.
So let's say I'm a frontline worker.
Mm.
I work on the front desk and I'm, checking in 50, 100 patients a day and I have concerns, right? Or I'm an MA and I have some challenges. What are some of the recommendations you will have for those team members on how to communicate that to their leadership so there is impact? Because it sounds like at the first FQ you started, you were able to deliver those messages were heard, they made changes to how you guys
Mhm.
were delivering service. What's the type of feedback that you would give to? I'm not saying this didn't happen at the other FQHC, but that
Mhm.
story stuck with me. What would you recommend to those employees?
I think this is just like an important message always is that our voice is very important. And if someone isn't listening the first time we say something, try to communicate it again and keep communicating it. And I think that's just an important message always, even like outside of this setting. But, the MA experience and the front office experience, contact center experience, those are all very valuable positions in a patient's experience at an FQHC. And so if you have MAs that are like truly unhappy with their position, they have unrealistic client loads, they have unrealistic expectations in their workload, that is going to trickle down to everything, truly. Same with front office, same with contact center. So at the end of the day, like, you have to think of the patient experience and you have to really determine how to, like, make decisions that not only improve the patient experience, but also retain your employees and keep your employees happy and engaged with their position. So, I mean, that can look like a variety of things, like cost of living adjustments for your employees, making sure that, like, you are hiring sufficient staffing ratios, making sure that like your contact center is trained on like customer experience and how to speak to patients, making sure you have options for patients that are checking in terms of like different languages, having someone at the front office that speaks Spanish or Mandarin, whatever that looks like for your clinic and its specific patient population. But I think at the end of the day, like, I would always tell the contact center front office to like really voice your concerns and keep voicing them. And if, you're going to your supervisor isn't listening, they're not like taking advantage of what they're saying, go to someone else. Like, because that is really valuable information to have. And I think that the executive team will listen if they hear something enough times.
So let's say I am that employee. I
Mm,
tried to speak up. I told everyone, right? My colleagues, my supervisor, their supervisor, everyone. And for some reason, or another, maybe they did hear me. Maybe changes are happening, but maybe I'm just burned out. I'm just tired, right? And for whatever reason, it could be good or bad, right? Good and me, maybe my spouse is moving, got an offer at another city and they want to move or whatever it may be. Or maybe I just had it with working at an FQ.
mhm.
And there's something telling me, hey, maybe you could go do your own thing. Maybe you could go consult, right? Well, what advice do you have for those folks that are considering doing that? And that could be at different levels, right? They could be at again, the front line, or they could be a director, they could be a whatever level. What advice would you give to those folks that are coming from an FQ that are at an FQ, but thinking about maybe making a move?
Yeah, I actually just thought about this the other day is that like leaving an FQHC doesn't mean that you have to stop serving those patients. And like if that is something that's important to you and you are mission driven, you can help the same type of patients just in a different way. And so I always think about that because I'm like, oh, like at first I was like, "Oh, am I, like, not doing, like, important work anymore because I'm not at an FQ?" But now I feel like I'm doing important work just at a different level. And so, like, I think that if you are mission driven and you're like, "Wow, like, I wanna see what it's like to create my own schedule and, like, really help on a different level in terms of like outside of just your community, then I think that consulting is definitely a good option for anyone who wants to pursue that.
So you made the move. You became a consultant. You're fully independent. You
Mhm.
don't clock in. You don't clock out. I remember in the beginning, you're like, "Hey, Alex, I'm gonna take the." I'm like, "Annalisa, you don't work for us. You're not an employee." I think I had to tell you that more than once.
I know,
Um,
I know, but I'm just telling you.
I remember, but I'm like, "Why are you calling me? Don't call me. I'm not your employer. I'm your partner, right?" Now that you've been here for 8, 9 months, what would you say is what is Alcar Health doing today that you maybe didn't understand when you first joined, right?
Mhm,
Like, where's your head at now? Like you say, like you're doing impactful work, but what
mhm.
would you say you've learned over the last 9 months doing the actual work that you were
I
not
think
even aware of before you joined the team?
mhm. So, two answers. For Alcar, I think that I really, really like that we really only service FQHCs, and that was something that was important to me. And I think that we get to learn as we implement certain things. And like, I like that we have solutions for FQs. We're like, we want to help you run better. We want to help you generate more revenue. We want to like have better return on investments and cut operational costs. I like that. And I think most FQHCs need that. So it's not even like cutting staff. It's like, no, we're trying to create things so it's easier on your staff. And that was really important to me because I feel like I would not be as like fulfilled with my job if I wasn't helping like we do at Alcar Health.
So far, I know it's still new. Is there something that you feel very proud of what you've done while being here at Alcar?
I think because I'm still so new, it's like, yes, of course. Like I'm happy of all the work that we do and like growing our exposure and bringing in like new clients and new states, even if like we don't have a signed deal, like just bringing in friendlies and learning more has been really valuable. Like getting to learn the system of New York and Texas and South Carolina, like that's been really exciting. And I'm like hopeful that as I continue to be a consultant, I can continue to learn each state's different like FQHC ecosystems.
So to wrap things up, there's a Latina woman somewhere out there working at an FQ,
Mhm,
listening to this, or maybe is a it could be a guy listening
mhm,
to this, right? It could be anyone, right? I only say Latina woman because it's someone that may look and relate to you and share the same cultural background. But I'd say for anyone that listens to this, what's the one thing you hope they walk away from?
mhm.
If they're listening to this, what's that takeaway that you hope they take with them?
I think, and Joe and I always talk about this, but it's like not listening to that doubt.
Mm,
I think like, yeah, just not listening to that doubt and realizing like you I always think this. I'm like, I deserve a seat at any table I'm at. Just because I'm a woman or I'm young or I'm Latina, like I deserve to be here. I wouldn't be here if I didn't deserve it. And so I think that that is like really valuable. And I would tell everyone to listen to that. Like everyone deserves, if you put in the work and you are like confident and you believe in yourself, you should absolutely get wherever you want to go. And don't take no for an answer.
there
I'm
you
like,
go.
"You can say no, but I'll ask you again in a week."
I'll come back. Awesome. Annalisa, thank you so much. Thank you.